So when it comes to fats and saturated fats, like we mentioned, like our grandparents used, the lard, the butter, are we finding that actually those things are good for us, or is it their replacements that we've been using in the last 20, 30 years are so bad for us?
That's an interesting question, because to this day, the American Heart Association still recommends that your fat intake, your saturated fat intake, be no more than 7% of your calories, and that's somewhat impossible based on food system, and they don't really give clear guidance as to what to substitute it with. And when you look at the research as to if you were to keep your calories consistent, your total fat percentage consistent, you have to substitute it with something. We ended up substituting those saturated fats with refined carbohydrates and polyunsaturated fats. And when you compare the stats, it's actually more troublesome for the polyunsaturated fats versus the and refined carbohydrates than it actually the saturated fats themselves. And some of the papers that have came out in the last decade or so, the researchers acknowledge that. They look at and they say, even if we assume that saturated fats were bad for you, and they really did cause heart disease, and these correlations and things were all correct, the role of the refined carbohydrates, sugars, added sugars, refined foods, is even greater. And so that should be more of the public health concern based on what the research is showing us. And another interesting fact, if you look at coronary heart disease, in particular, involves arteriosclerosis and thickening of the arteries. And if you actually look at what comprises the plaques, it's polyunsaturated fats. This is a Lancet study in 1999 where they actually looked at what composed the plaques, and 3/4 of it was oxidized polyunsaturated fats. Again, the soybean oil, the corn oil. And so it's really the oxidation of those fats that's more of the issue. And saturated fats are naturally more stable. They're not going to be as susceptible to free radical damage as these other fats. And sugar is a big influence in there in terms of creating that oxidative stress in the first place. So that combination of unstable fats on one side and high sugar is sort of a deadly cocktail when you look at heart disease risk.